Sounds good.
Right, good morning, everybody, and welcome to this TCPA webinar. We will do that thing where we spend a couple of minutes just allowing people time to log in, but I hope everybody is well, and we'll get started in just a moment. Great, so welcome to this TCPA webinar, which is One Role, Multiple Systems, Public Health and Planning Roles in Local Authorities. And thank you for taking the time to join us this morning. My name is Gemma Hyde. I'm a Projects and Policy Manager for Healthier Places at the Town and Country Planning Association. So the TCPA is a charity with a vision of homes, places and communities in which everyone can thrive. And our mission is to challenge, inspire and support people to create healthy and sustainable and resilient places that are fair to everyone. And our work covers quite a few different things, including new communities, healthy homes and neighbourhoods, climate change and community participation. But our healthy placemaking work has really for over a decade now really been focused on bringing together, indeed bringing back together, public health and planning. So disciplines and professions that emerged and tackled together challenges that arose from industrialisation and how people started to live in cities and the challenges that brought in terms of environmental health, but physical health and mental health and well-being as well. So on our website, you can find, sorry, Jack, can you go back one? On our website, you can find lots of free resources and guidance, including Planning for Healthy Places, which is a guide we wrote in collaboration with the Trude Research Consortium, worth looking up if you've not come across their work. But essentially, just a bit of a how-to in terms of embedding health and well-being into local planning policy and local plans in England, particularly. We also have a range of conference and webinar recordings that are similar to this one today, and then also a group of case studies that cover different elements. And our work also covers our campaign for healthy homes, work we've done around 20-minute neighbourhoods, and also quite a lot of recent work around children and young people and child-friendly environments and what they look like and how do we create those. The TCPA also offers a lot of support to local authorities in terms of health and well-being, and we have supported over a number of years now the roles that we're going to hear about today and some of the people on this call. And we act as a bit of a trusted friend and an extra resource for people to draw on in terms of working out what they're doing and looking for connection to other people or examples of what other places have done. Much of our healthy placemaking work is possible due to ongoing support from Sport England, and we are really grateful that this means we can provide many of these resources and even this event to you today for free. Next slide, please. So today's webinar is also a collaboration with the Health and Wellbeing in Planning Network, a collaborative network of planning professionals, public health practitioners, NHS estates, researchers, community advocates, and everyone in between, really, who is working on and recognising that connection between the built environment and human health. And you can find out more about the network and how to join by following that QR code. And I'll also try and put a link in the chat. But essentially, it's a sharing peer-to-peer support network that run webinars and also some in-person events as well. Next slide, please. So briefly, why are we here, right? What are we thinking about today and how are we thinking about health? So it's really important that we start with an understanding that building good health and protecting people's health is a complicated picture. Most people, when they think about health, if you ask them, will still think immediately about health care services, about the NHS. And of course, healthcare is vital, but the NHS was never meant to go it alone in terms of what builds and supports our health. So many factors affect the health and well-being of people. It might be the food that they eat or have access to, their work, community, but essentially it's the environments and the experiences that surround people. And we really know this intuitively when we start to dig into it. So we often call these factors that affect people's health the wider determinants of health, and the Health Organisation has some really good work about the building blocks of health, like how we talk about these things is important, and how we can create good foundations and help people build health and deal with some of these things. And when we think about planning and place, planning shapes the delivery and quality of many of these things. And that's why it's so important in this conversation. Next slide, please. So this is far from an exhaustive exploration of some of these building blocks, but essentially you can start to think about it and unpack all of these different things that planning gets involved with. And it becomes quite clearly, such a key thing in this, but also quite a complicated thing. And we start to have all of these different bits of systems overlapping and thinking about different things. So it might be that you've got professionals from climate change and thinking about flooding. It might be you've also got people thinking about art and culture, and in terms of how that all works out in the built environment and through planning, we need people who can understand these different things and how they interact and how they build on each other in terms of creating good health and well-being. So it's a really complex picture. It's really interdisciplinary in nature, and there's a real need for not only broad but deep expertise. And so some of the roles that we're about to hear from, that's what they do. They sit at this intersection, specifically around health and planning, in order to try and complete work in this space that is needed and impactful. Next slide, please. And the good news is that there is some research that backs up why these roles are important and how they're making a difference. So there's 2 bits of recent research from FIRST, and I know that colleagues will probably touch on this as well. But essentially, it's research into how hybrid roles between public health and planning have emerged, and the research demonstrates how these roles work, what they achieve, and why, which is really great in terms of supporting decisions around creating new roles like this in local authorities, but also maintaining roles that have already started. Next slide, please. So we're going to today hear from 3 people who are already doing this work and have been doing so for varying lengths of time. Lourdes, who is going to speak to us as the Public Health Strategic Lead from East Sussex Council. David, who is the Creating Active and Healthy Places Lead at Middlesbrough Council, which is Public Health South Tees. And Kim Wilson, who's the Public Health Principal for the Built Environment from Milton Keynes Council. And we're going to hear briefly from each of them. And then importantly, we'd really like to ask them some questions, and I'd like to be able to ask them the questions that you're thinking about as you listen to them. So I'd really encourage you to use the Q&A box at the bottom of the screen to leave questions as they speak, and then we will spend a little bit of time putting those to Lourdes, David and Kim before wrapping up at 12:30. So you can stop sharing there. So that's the plan, and I'd really like to thank you for everyone's time on the call. And Lourdes, I will pass over to you to begin sort of this knowledge sharing webinar that we've got today.
Thank you very much, Gemma. Just going to share my screen. Can you confirm that you can see that fully?
I can, yeah.
Lovely, thank you. Good morning, everybody. I'm Lourdes Madigasekera-Elliott. I'm the Public Health Strategic Lead for Creating Healthy Places here in East Sussex. Just a little bit about who am I? Well, I started my public health career in Essex as a practitioner, and it was there that I was introduced to the Planning for Health agenda and the Health in All Policies approach. And then I moved to West Sussex, where I was instrumental in helping to develop the Creating Healthy and Sustainable Places, a public health and sustainability framework that was centred around trying to embed planning and public health and bringing that relationship closer together. From there, I've moved to East Sussex, and what was instrumental in terms of bringing my team as well as myself together was the Director of Public Health's report on health and housing. So our director is Daryl Gale here in East Sussex. We're very fortunate for the fact that he's very unique because he is actually an architect by background. And so naturally, he really understood the importance of focusing on the environmental determinants of health. And his DPH report, which was done before I actually came into post, you can see there 2019 to 2020, was what unlocked the argument around the investment for healthy places, specialist posts, particularly that type of post to basically bridge and integrate and better advance health and wellbeing considerations into the planning system. Of course, planning does that, but there is a different understanding sometimes, the real gaps in how to fully integrate health considerations into trying to tackle health inequalities through the built environment. So that's how my role emerged, and through that I made the business case to basically invest in 2 further posts, which included bringing in 2 planning professionals into the public health team to then be able to do the work that we do. But we are a broader Healthy Places team. So as part of that, Health in All Policies hangs as the umbrella in which to deliver various priorities around the built and natural environment. We have recently taken on leading in on climate change for the public health team, and we're doing a health impact assessment. Another arm is obviously planning for health. We have developed a hot food takeaway guidance. We do a lot of work around transport schemes and consulting on that. And we've done a health impact assessment on our local transport plan. And we also offer expertise around health impact assessment more broadly. So, for example, we're doing a HIA on our flood strategy, and we're also doing a health impact assessment around the regeneration project in Hastings. So that gives you an overview of our team. We found it really, really important to evaluate the changes that we're making as a planning for health specialists within the Healthy Places team. So we did a collaborative evaluation around the investment and the system-wide changes that investment in posts like mine and that of my colleagues in the team brings about, and we did that with Southampton City Council. So that was the first evaluation around investment of these types of posts, and I know there have been subsequent ones up and down the country, Milton, Keynes and Oxfordshire, for example. And we found the main thing from the study is that actually investment in these types of roles brings about changes in knowledge and skills and ways of working that are really instrumental to building and creating, healthy places. So I really encourage, having a look at that evaluation to kind of learn more about that. So what are the current kind of things that we're working on at the moment? We're developing some unique planning for health tools that actually our planning system, and I should be clear here, we've got a 2-tier system. So a county council, and we've got 5 district borough councils and a South Downs National Park, which is a planning authority in its own right. And what we want to do is, in public health, we're facilitating and enabling a consistent approach to placemaking. Because what we don't want to see is disparities are being addressed in one place through healthy environments and the creation of healthy places, but they're kind of getting worse in other places. And it goes back to that whole thing around the difference of life expectancy from one neighbourhood to another. So our role is to provide guidance. It is also to provide evidence and data, but that's the very basic thing that public health does. We help to justify and develop policies. We raise and increase capacity building. And as I said, we're about trying to create consistent and holistic placemaking. We are leading without authority here. So public health, as we know, is not a statutory consultee at the moment. But what we do have, despite that, is a real partnership and a real understanding that people want healthy places at all levels within the system. So we're a fellowship. I'm a big Lord of the Rings fan. And whilst we don't have a ring to unite us all, what we do have is a memorandum of understanding. And that is an MOU that is signed by all of the local planning authorities and our Director of Public Health to say that we will abide by duty to cooperate and that we will work together to deliver specific actions around this agenda. So you're probably thinking, so what, you've got an MOU? Well, the MOU gave us the mandate to establish a public health and planning working group, and that's been really, really great to bring together planning policy and development management to try and develop key processes in which to integrate and advance health, whether that's developing the policies, whether that's development management processes, or responding to planning applications. It's also a group where we build our skills and our knowledge together, and we're basically proactively trying to enable planning for health and deliver against the MOU. Now, I did mention we're a two-tier system. So what, you've got an MOU. How does that resonate to each of the local planning authorities? Because placemaking looks different in each of those places. Development looks different. So what we do have is engagement process protocols or individual working agreements that are basically identify the specific detail and support that public health will give across those authorities. And it also provides the thresholds and the triggers in which public health will respond to planning applications, but also the requirements for HIA, for example. Alongside that, we're also developing at the moment, and we're about to launch this year, a number of healthy places tools. So that includes a planning for health and wellbeing sustainability framework. We've launched a Healthy Places data profile that shows the data and evidence that we need for creating healthy places. And we're also launching a health impact assessment tool that provides all the HIA templates in which developers and quality development management can use to basically work through a HIA and quality assure a HIA as well. So we're doing a lot, as I mentioned, around health impact assessment. But obviously there's a bit of a nut there, caveat. Emerging local plans with a HIA requirement are taking time to be adopted. And in the meantime, it's about establishing what we do before a HIA is in place and after. So we figured those out about how to respond ahead of the HIA requirement and what comes after. We want the toolkit to be consistent, user-friendly, proportionate, and add benefits. And just a very quick overview on our current priorities. At the moment, we started last August responding to planning applications. We continue to influence local emerging plans and neighbourhood plans. And as I said, we're setting up public health as a key consultee for consultation around those planning applications and HIAs. In addition to this, we're very conscious of other work streams and priorities where thresholds and triggers must be considered. And that includes applications around gambling and hot food takeaway premises, sports facilities, for example. And so those are being considered on a case-by-case basis. The framework, just to give you a little bit of detail, is a guidance for all involved in the planning system, and it provides a clear steer on the health and wellbeing considerations related to planning. And I know plenty of local authorities up and down the country have developed some of these frameworks, so it's worth taking a look at those because they're very, very helpful in terms of providing that overall vision of what we mean by planning for health and how we will deliver and justify, the ask around it. Here's a link to our Healthy Places profile, which is really helpful for developers and investors. A little bit more detail around our HIA toolkit and the HIA manual and templates and what they do in terms of supporting implementation requirement for planning applications in East Sussex. Thank you very much for your time, and I hand back to Gemma.
Great. Thank you, Lourdes. Yeah, it covered an awful lot in a short period of time, so I appreciate that, and hopefully we can unpick some of it again, please do pop any questions in the question box as we go through, if you'd like to ask Lourdes something about some of that. And then we'll pass over to David to hear from Middlesbrough experience.
Great. Can you see my slides?
I can, yeah.
That's great. Okay, so good morning. I'm looking forward to sharing with you some of the work that we've been doing here in South Tees. So I'm going to, first of all, I'm going to walk you through the creation of my role as Creating Active and Healthy Places lead. And then we'll talk about some of the work that we've been doing. So we'll do the role first, then move on to work that I've been doing with colleagues in Middlesbrough Borough Council, in strategic policy and in development management. And then we'll move to some work that I've been doing with colleagues both at Redcar and Cleveland and Middlesbrough in response to December 24's paragraph 97 update in the MPPF. So we'll make a start with my role. Now, You've Got This, which was one of a dozen local delivery pilots created nearly a decade ago by Sport England and charged with doing things differently to promote physical activity and address physical inactivity through the whole systems approach based around places where people live, work, commute and play. Now, some of the key roles within You've Got This were integrated into Public Health South Tees, as mine would become more recently. But from 2017, the director of You've Got This has been part of Public Health South Tees. And from that point, 2017 onwards, they've been working with colleagues across public health as well as within Middlesbrough Borough Council and Redcar and Cleveland Borough Council. So that includes colleagues in development management, in strategic policy, as well as transport planning. And early on, workshops were convened with the TCPA and the RTPI, but because this was a few years ago, the RTPI then President Timothy David Crawshaw, along with Gemma here, were working to try and develop, not develop the recognition of a need, but then to try and work with colleagues in planning and public health to identify what would make the biggest impact, given the agenda of You've Got This and Sport England, when it comes to addressing these issues of physical inactivity, physical activity, and inequitable access to opportunities for physical activity. And what was decided was that the creation of one of the hybrid roles that we're talking about this morning would be a good first move in that direction, particularly as public health for a while had wanted to work with colleagues to develop HIAs within local planning policy. And there'd been, whilst there's enthusiasm with colleagues in public health and planning, it hadn't really come to fruition the way that they'd hoped it would. Now, there was, under Gemma's guidance, the Public Health Middlesbrough Council approached public practice because there was already proving a problem recruiting new planning officers to the northeast and into Middlesbrough. So they thought they'd try a different tack. And the route that they took was to approach public practice, which is a not-for-profit designed to help mid-career built environment professionals transition into public sector roles. Now, I was already on their associate program, having completed my doctorate training as a social biologist who approached the built environment through the lens of public health. And I'd become interested in public practice based on their recognition and their kind of mission statement that the built environment, this is quote, the built environment is where the symptoms and solutions of society's most complex challenges are played out. Now, Gemma knew that public practice had been able to provide Greater Manchester Moving with the architect Kelly Marie Rogers to work in a similar sort of post, one of these hybrid posts, as their healthy and active places lead. So all of that work came together all before I started, and that was the genesis of this particular role here in South Tees. Now, I'm going to give you a very brief overview of the work that we've been doing over the last couple of years. But if you're interested in a deeper dive, then there's a hyperlink at the end of this presentation into the case study that's been produced by You've Got This. So feel free, and also feel free to reach out if you want any more detail about that origin story of the post. So where are we? I'm going to start where we are now and then go back a little bit. So as we speak, actually Middlesbrough's local plan is under examination. Next week, we've got the public hearings, and before I arrived, there was a clear ambition. Obviously, my appointment is an indication of the ambition already within Middlesbrough and Redcar and Cleveland of having health as a central part of the vision for the local plans. So when I arrived, the strategic policy manager, Alex Conti, was very keen almost immediately. So I arrived at the end of autumn of 23. By the start of 24, Alex had invited me to conduct a health in all policy assessment of the then emerging local plan. So there was the obvious policies that he wanted my attention to be, wanted me to concentrate on. But in addition, Alex and his team were very keen that there would be a health in all policy approach to the local plan and that it was a cross-cutting theme. So we looked at all of the policies that you'd want to be able to introduce health and well-being aspects to. So we, again, working very closely with colleagues in strategic policy, we got to look, having made the assessment, we got to look at each of these policies and make more robust the evidence and make more robust the language in there around the health and wellbeing agenda. And the health and wellbeing policy itself, Alex and his team invited me to contribute to the policy language, but also to the explanatory text that supports the health and wellbeing policy. And we've heard already from Lourdes how important health impact assessments are in this space. And as I mentioned, my colleagues in public health have been very keen to make sure that health and wellbeing, that health impact assessments were part of the local plan going forward. So we worked with colleagues in strategic policy to make sure that the language was robust around the need for the health impact assessment, and just to make sure we're all on the same page about what a health impact assessment is. Gemma mentioned the publication TCPA and Trude produced. So this is our working definition, that it's a process that identifies health and wellbeing impacts of any plan or development project. A properly conducted HIA recommends the measures to maximize positive impacts and minimize the negative impacts to reduce health inequalities. So we built on the great work that was done by John Wilcox in Wakefield, working with colleagues in workshops, transport planners, development management planners, and with strategic policy. We've created the health impact assessment for Middlesbrough. All of those building blocks that Gemma mentioned at the beginning are all obviously themes within that, those wider determinants of health. And for the second part of my short presentation, we're going to now turn to that, the good food environment and how important that is. So that's one of the themes in our health impact assessment. But obviously, with the change to the MPPF, I'm going to pivot here to the change to the MPPF in December 2024. That chapter 90 and paragraph 97 gave us another policy lever to address the good food environment, particularly hot food takeaways and fast food outlets. And the week of that publication, I was in one of my regular meetings with colleagues in Redcar and Cleveland Borough Council, and we recognised that with the addition of that from the MPPF and the work that the policy we had in our local plan, which was more of a vitality and viability test when it came to HFT applications, that we'd be able to develop a more robust public health test response to applications as they came in. So working with colleagues in the data analytics team in Public Health South Tees, we've created this data asset along the methodology, adopting a similar methodology to OHID's wider determinants of health profile for fast food outlets. And we're using this data asset now when applications come in to build a robust case if we have any concerns about the application, ensure that we've got really good justifications in our objections. We are identified as consultees on those applications as far as the local planning authority are concerned in both Middlesbrough and in Redcar and Cleveland. Yes, and as I mentioned, we're under examination at Middlesbrough, and their policy, again, had the vitality and viability test front and centre, but did introduce some of the, coincidentally, have those tests, the public health tests to do with distances. And again, that's all factored into this new data asset that we've developed. And here you can see Middlesbrough is a town of two halves with a slight gradation in the middle. And if any of you know what, so these figures here, nationally, 36.6% of children are overweight or obese at year 6, and in Middlesbrough, there's a considerable issues in the north part of the town, and slowly graduates down to the more salubrious parts of town where it's less of an issue. But again, we're using this evidence to support our responses to any applications that come in. And finally, next steps, the sort of work that we're moving on to. So we have created another role along the same lines of the hybrid role that mine is. So a Healthy Places planning officer who I've been working with since he started his apprenticeship in planning in Middlesbrough. Well, should he be the successful candidate, that is, will be recruited over the next couple of weeks to work with us on the operational side of the new HIA policy that we have in the local plan in Middlesbrough. We're also working on developing active travel route, the Middlesbrough South active travel route, again with the Healthy Places planning officer, colleagues in transport planning and colleagues at the combined authority level in the TVCA. And at Redcar and Cleveland, we've got the upcoming local plan review, where I'm going to work with colleagues, with officers, but also with the engagement of members on addressing the obesogenic environment by the review of the local plan. So thank you for your attention. And there is the link that I mentioned to the case study and my email, so don't hesitate to get in touch if you'd like any more detail from me.
Brilliant, thanks, David. Again, so much covered in a short period of time, so we'll tease out some of that in just a moment. But we will hear from Kim first, just to sort of finalise the bits of the conversation. So, Kim, if you would like, if David can stop sharing, then Kim can start.
Yeah. I'm trying to.
I think she's thrown you off.
Brilliant. As she should.
Have I bumped you off?
You have, yep. Great, Kim, go for it. Thank you.
So you can see my screen,
I can see your screen, yes.
Okay. Thank you. Well, I was going to say good morning, but it's afternoon. Good afternoon. I'm Kim Wilson, and I work in the Shared Public Health Service covering Bedford, Central Bedfordshire and Milton Keynes. which serves approximately 750,000 residents. And the Healthy Places team includes professionals from planning, public health, social housing, and academia. Our team was established in 2022 as a result of looking at the building blocks of health and identifying the need to address health inequalities by influencing more than just the health sectors. And we know that most ill health is preventable. So in basic terms, the team focuses on things that can prevent people becoming ill in the first place. A little bit about me. Up until my public health role, I've always worked in planning policy in local authorities, and my previous role was in the planning policy team at Bedford, where I led on health, including integrating health into the local plan. I worked closely with colleagues in public health. I contributed to the joint strategic needs assessment, and I worked with my predecessor, Sam, to develop a health impact assessment framework for planning applications in Bedford. And when Sam moved on, I saw the opportunity to focus more on influencing health through planning, and I joined the Healthy Places team in February 2025. My role is about sharing what's actually going on out there. What does the public health data show? There's lots of it, and we can help with interpreting it. I also try to advocate for a health in all policies approach. I aim to ensure public health meaningfully engages with the planning system. I try to support planning policymakers to integrate a public health perspective into local plans and policies. And I aim to assist case officers in improving health-related outcomes of development management by contributing evidence and a public health lens. And I work with various partners to create healthy places whilst thinking about the health needs of underrepresented groups. Within our shared service area, the Milton Keynes plan is slightly further ahead in its preparation, and I've been asked to talk about the health impact assessment of the Milton Keynes plan. And much of this work took place before I joined the team. Creating people-friendly and healthy places is a key objective of this plan and the planning system, and a significant amount of groundwork was put in at the earliest stages of this plan's preparation, where public health worked proactively with the planning team, building the rationale, the evidence base, and preparing a topic paper. And this firmly embedded health and wellbeing into the plan right from the start. As part of the preparation of the draft plan, an HIA was undertaken, led by Public Health, working with consultant Ben Cave, and it considered the potential health impacts of the plan. And as mentioned, Public Health were able to provide data to inform and help identify the opportunities to improve health and tackle inequalities through the local plan. In addition, a public engagement project was undertaken called Voices of Milton Keynes. It reached a diverse demographic through a series of interactive workshops, and this means the local plan takes into account qualitative information more than just the public health and other data. The HIA considered what impact the plan is likely to have on health and wellbeing in Milton Keynes, and it made recommendations about what could be done to strengthen the health focus of the plan. Then during 2025, following the Regulation 18 consultation, a refreshed health impact assessment was undertaken as part of the pre-submission plan preparation. And this builds on the Regulation 18 HIA, and it considers the potential health impacts of the changes proposed to the plan as a result of the consultation comments and any other changes as a result of the MPPF and other evidence-based updates. We commissioned consultants RPS, led by Dr. Katie Hirono, to help us, and they provided and proposed what we considered to be a very effective approach. So Katie worked with each of the lead officers, working on the policies covering topics that influence health, such as growth, high quality homes, people-friendly healthy places, infrastructure, climate and environment, and movement and access. The officers discussed with Katie the changes they were proposing to their policies, and they explored their potential to impact health, who would be most likely to be affected by the policy, and whether there were any tensions between the policy and the goals of the plan. So these were 1 hour focused sessions. And then RPS made some recommendations for the policy leads to consider. And there was then a helpful back and forth discussion by email with various drafts and other changes, which really resulted in a truly iterative process, with HIA findings being fully taken into account before the Regulation 19 plan was finalised. The plan is still to be tested through examination, which is anticipated to take place later this year, but two things have stood out for me. Firstly, how wonderfully bought in the policy leads were, and this facilitated the open, candid and iterative process. And secondly, having drafted a local plan previously and been fully committed to creating healthy places and including an overarching chapter and a health policy right up at the front of the plan to be a golden thread running through the plan. And that approach is great and fine. But this approach taken in Milton Keynes has really opened my eyes to what health in all policies actually means in practice. And by considering more carefully the health impacts of each policy, the who and the how has resulted in changes to those individual policies, which I think will be more effective in achieving good health and wellbeing outcomes. Thinking about other ways we can reduce health inequalities across our 3 local authority areas, my team also works with other partners, and some examples are listed here. So we're working with transport colleagues on their local transport plans, and I'm hoping we can incorporate an HIA approach to their preparation. I'm working with healthy weight colleagues, building the evidence base around food environments, and we're exploring access to healthy, affordable food and identifying food deserts. And we're looking at the management of hot food takeaways and fast food outlets, and in that we're involving young people to get their input to understand how and why they use them. In terms of licensing, we've been working in Milton Keynes and we've managed to add vapes to the prohibited list of sales by street traders. And we've added healthy food and drink options to guidance for street trading applications. We're working alongside housing associations on their new and regeneration schemes. And we're looking at the buildings, but we're also looking beyond to the surrounding environment and creating healthier places. And we undertake a type of health impact screening of the regeneration schemes, which looks at health and deprivation data for the area, because often these estates are set in our most deprived areas. The screening looks at the determinants of health and positive and negative impacts of the scheme on vulnerable groups. And then connecting into this is the analysis we're doing that I mentioned before on food deserts, the accessibility of affordable fresh food. And we've plotted supermarket walking catchments, social housing postcodes, and areas of highest deprivation. And we've started to think through potential solutions, which could be through working with the Community Food Initiative Network. And we're planning to work further with them. In fact, yesterday I attended a food summit, Central Bedfordshire Food Summit, that explored that further. As planners, we're trying to create opportunities for physical activity, active travel, and accessible community facilities within developments. That's the panacea to influence behaviour right from first occupation and to monitor the delivery of mitigations. But as we know, that doesn't always happen. But also, how do we tackle inequalities in our existing areas where there are no development proposals to facilitate change? Through our Health and Housing Partnership, we're working closely with local housing associations and Be Active Beds, who are supported by Sport England funding. And the Place Universal offer represents a whole system approach working across housing, health and community sectors to help residents in underserved communities in Bedfordshire to become more active. And then we're also always looking for opportunities to work with partners to evaluate what we do. So, for example, Milton Keynes were involved in that first study looking at the benefits of hybrid posts that was mentioned earlier. And we're currently working with Michael Chang as one of the authorities he's evaluating as part of his PhD on systems and how planning and health can work together. So as a final thought, there are many opportunities a post like mine can create. A key one is being an additional resource to be able to influence developments at the earliest stage, firstly through policy development, gathering the evidence base to support the plan, and being an extended part of the wider planning team. And secondly, by commenting on applications and ideally at the pre-application stage. This is much likely to be effective in influencing development than providing comments at a later stage when it can be challenging to make any significant difference. Thank you.
Brilliant, thanks, Kim. If I could get Lourdes and David to just rejoin the screen. So we're gonna battle through some questions, and I will, if I think they're appropriate, direct them to a person, but please feel free to also jump in and answer. I think we're just going to have to tackle this one first because it's always a question, and that is a twofold really. One is how do places justify the costs and the expense of roles like these, and has that been a challenge, and how to maintain, I guess, in the cases where these posts already exist, is it always a challenge to maintain the funding for those? And equally, I try and tie into that if we can, how these roles can come about where there aren't sort of good pre-existing relationships, particularly between planning and public health. So, Lourdes, do you want to just take that first, probably as the most long-standing sort of authority in this bit?
Thank you, Gemma. Yeah, I mean, it's an interesting one. The planning for health roles, I would say, I started my public health career in 2016, and Essex, I was up in Essex at that point. Essex were sort of at that point looking into the planning for health, and they were quite passionate, thanks to the championing work of Michael Chang, to get practitioners up to speed with planning for health. When I went to West Sussex, I had a remit of health in all policies, but they hadn't actually fleshed out what policy area to focus on. And it was because of that background I really championed planning for health. But they didn't know at that point the real value of it until I developed the West Sussex framework. And I believe that was the first framework of its kind, solely focused on planning for health. And at that point, that was more. It was kind of championing people that are willing, and you'd be surprised. This isn't just a public health call out. The planning system itself is really asking for engagement from public health. And the planning system itself wants the evidence to justify the policies around health. So there is this innate natural call, I would say, between the two disciplines to bridge planning and health. And I think there's been a lot of momentum around that, because it's in the early days, it was just a case of the willing. Now the evidence is emerging through evaluations around these posts and through on the ground sort of people doing and investing these roles that are clearly justifying the cost. And that's why we've seen an exponential growth in the investment of these posts, literally in the last sort of 2 to 3 years. When I started, I think there were only a few people doing it, literally less than 5, like local authorities. But now the last time I went to the Planning for Health Network, the national one that you've referenced, I went to the summer forum, not last year, but the year before. There were over 28 practitioners from local authorities, and the number continues to grow. In terms of maintaining it, as I say, the evidence is emerging. More DPHs, directors of public health, and councillors are really interested in this link between health and housing. We've had a lot of discussion around damp and mould. We've had a lot of discussion around air pollution. So it's natural that we synergise roles around planning and health, and that in itself maintains the argument to continue investment.
Yeah, brilliant. I think that's come out so strongly, is this, it's the work around the planning system, but also so much beyond the planning system, and that's what these roles bring. David, is there anything you would add in terms of bringing different funding pots together in the sort of Middlesbrough and South Tees experience?
Yeah, and I think it's happening in Milton Keynes, and I know that your work with lots of other places, Gemma, has found ways of aligning the Sport England, the active design, the active partnerships work with the work in place around local plan development or the creation of new policies or SPDs in response to the health and wellbeing agenda. So that investment with Sport England, tied in with ambitions within public health in those respective areas, align with, like Lourdes just outlined and you echoed, Gemma, the ambition already within colleagues in planning to ensure that there's a robust evidence base, but that we know what levers work and what investments, so these posts, for instance, how these investments work when it comes to creating that policy environment that supports this work.
Would you just add to that, David, and maybe say a little bit about if you think, so there's a question about, does this just duplicate stuff that's already generally
so I saw
required?
that question. Yeah, and I think I wouldn't use the word duplicate. I think it aligns, and there's a recognition that some of the work that was already being done about good design generally promotes the sorts of behaviours that we would want as health promoting behaviours. So I think it's a matter of recognising that the policies are already in place, and then possibly making explicit for colleagues in design the extent to which they also promote the sorts of patterns of behaviour that we know to be the ones that affect the wider determinants of health. So by foregrounding the mechanisms that good design leads to good health outcomes, I think it makes for more robust good design policy, but also provides us with ways of having that health in all policy approach made explicit for colleagues in design, and then look for sharing that as good practice.
Yeah, great, thank you. Kim, it feels slightly unfair to ask you this question as you're still getting the plan MK, or no, plan 2050, whatever it's called these days, through examination, but just reflecting on the health impact assessment of the local plan and that process, have you done any thinking in terms of how that might work out in the new planning system and the new local plan making regulations, in terms of, if it's a 30-month plan making time frame, how can health impact assessment of the local plan fit into that at all, or any thoughts?
Well, actually, we didn't find the process took very long. Obviously, you needed to be involved at the key processes to make a difference to what the plan was saying. But actually, the process, for example, with RPS didn't take very long. They were 1 hour targeted focus sessions, and then with follow-up. So actually, it didn't add. I don't think it added anything to the timetable that wouldn't have been there as part of the preparation timetable anyway.
So essentially, it ran in parallel, and you envisaged that it could run in parallel with the new system. Great. Is there an example, Kim? Could you point to an actual policy change that came about because of that health impact assessment of the local plan?
Yeah, in lots of cases, it reaffirmed changes we were thinking about making anyway, but one of them was about infrastructure, and something that had come through the consultation about how there isn't the infrastructure people need, it's delivered late, or it's not delivered at all. And then the HIA pointed out quite often that infrastructure is provided to cater for young families, but we need to think about the ageing population and make sure that there are facilities for all age groups. And so that resulted in an infrastructure first chapter and a policy that requires infrastructure early for all users, and to consider if it can serve existing residents as well, because the HIA also looked at the inequalities that are created by new developments and how residents of new developments have these new shiny facilities, whereas in existing areas they have tired facilities. So if there's any chance of a new facility to also improve things for existing residents, that should be taken too.
Thank you. And then maybe Lourdes, in terms of the health impact assessment work that's been done, are there also plans to think about how that's monitored and the actual impact of the health impact assessment sort of over time, which is quite a difficult question to grapple with, but I just wonder how you've been thinking about it, or anything you've already done in that regard.
Yeah, I mean, it's something, as I say, we're a team that established in 2021. And so we're developing these processes from scratch. We haven't got to the point, obviously, of because we're at the point of trying to introduce HIA as a requirement in the local plans, and all of our district borough councils have signed up to that requirement. At the moment, because there's no formal policy in place as the local plans are being reviewed, we're at the stage of trying to then encourage developers to do that in its place. But we are thinking about evaluation via the local plans in terms of their annual monitoring reports. So that each of the local plans, as I understand it, have monitoring indicators. And the intention in the future is to develop indicators around HIA as part of that evaluation and monitoring process. But also, it's also about creating our own kind of evaluation framework around that, and also keeping a log of how we're quality assuring. Now, as part of our templates around HIA, we were very clear that if a local planning authority didn't take forward a recommendation that we picked up that was necessary we felt was necessary for the developer, we want feedback on why that hasn't been implemented. So it's a case of now us building and storing what's actually happening, what's changing, because of course we don't want HIA to be there and then not hear back how the recommendations have or haven't been taken forward, because that's critical for kind of continuing to make the justification for this process. So it is in our minds. We haven't quite bottomed it out yet, and I don't think we're at that stage, but we are seeing some inroads via monitoring via the local plan, but also our own monitoring processes that we'll work up and develop.
Yeah, brilliant. Thank you. There are a few other questions, but we're sort of running out of time. And there's a few things I would like to flag to people on the call. So there's been a couple of questions around sort of good practice documents and things like that, and also specifically hot food takeaway appeals. So I would really encourage people to go and look for the Healthy Places Knowledge Hub, which is the OHID sort of knowledge hub for people who are working in this sort of sector, and there is quite a lot of conversation and sharing that goes on there in terms of especially things like recently hot food takeaway appeals, and also to look up the health and planning network in order to sort of again engage with other people who are working on similar things. If there's any questions in the chat that the speakers would like to answer before they leave, then please feel free. Pride in Place is a whole other thing, but absolutely could interact with health and placemaking, and is already doing so in various places, as something we might pick up in the future if there was a need or an ask. Jack, if you can share the last slide, that'd be great. But just to say from me, yeah, thank you very much for coming. Thank you to our speakers. We will continue to highlight some of this stuff and support roles like this, and welcome any conversations that people would like to have with us in terms of exploring that. And also to say that the TCPA, we are a membership organisation. So if you'd like to join, there are various benefits, not least being able to join lots of events like these ones, often at a discounted price when they aren't free. And also 6 copies of the journal that we publish every year. And to keep an eye out on our events page on our website. And there's a continual stream of things that we're trying to do to share good practice and have great conversations like this one. So thank you very much, everybody, and I hope you have a good rest of the day.